Imagine a morning like this. You know your birthday is in a few days. That family is visiting this weekend. That friends planned a night out. Once, just thinking about it was enough to make something stir inside you. Some anticipation, some excitement, and now nothing. Your favorite coffee tastes ordinary today. You drink it out of habit. Music you could lose yourself in for hours now barely reaches you. A child runs to you with a drawing. Your partner is laughing. Mom calls with good news. You hear it all. You register the facts. But that pleasant warmth that used to accompany you in such moments, it's gone somewhere. You don't even know when it happened. It's not just a bad day. And it's certainly not something you can chase away with willpower. It has a name. Anhedonia. If for even a moment you felt this description fits you or someone close, it's good you're here. Because today we'll talk about what anhedonia really is. We'll check what happens in the brain then, and most importantly, you'll learn how to cope with it. The word anhedonia comes from Greek. It literally means a state without pleasure. In psychology and psychiatry, we define it as the loss of the ability to feel pleasure from activities that previously provided it. Or, just as importantly, the loss of motivation to even reach for that pleasure. This distinction is key. Anhedonia has many faces. Consummatory anhedonia is the inability to feel pleasure while performing an activity. For example, you eat your favorite dish and don't feel the taste. You watch a comedy with a partner who's laughing out loud, and you are indifferent. You're physically in the experience, but you don't feel pleasant emotions. Anticipatory anhedonia is the lack of ability to anticipate pleasure. Nothing excites you. There's nothing you're looking forward to. No prospect or possibility has the power to pull you along anymore, to motivate you or give you that sense of excitement. And it's this second type, the lack of anticipation or expectation, that's often even more disruptive and unsettling. Because if nothing at all seems worth the effort, if nothing feels meaningful or important enough, why would you even bother to get out of bed in the morning?
You know, the worst part is that I still like them. They're my friends. But when they're crying with laughter, I feel like I'm watching a movie in a language I don't know. Nothing touches me, not their joy, nor the fact that one of them has a problem. I used to cry at every romantic comedy, but now they could show the end of the world and I'd probably just think that at least I don't have to go to work tomorrow. This emptiness is worse than sadness. At least you can feel sadness.
Shopping used to be fun. Looking for meat, spices. Now I walk between the aisles and everything is gray. I can't smell anything, I have no taste. I throw anything into the basket that has an expiration date longer than a week. My wife asks if something happened, and I don't know what to tell her. Because what should I say? That cooking, which I always loved, suddenly seems as fascinating to me as filling out an Excel spreadsheet? Well, it's pointless.
I don't know why I came here. I think my husband talked me into it because he noticed it's strangely quiet at home. Something was always playing at our place. Now I come home from work, sit down, and look out the window. I don't even have the strength to choose a song. It's too much effort to decide what I want to listen to, since everything sounds just as flat anyway, as if I were eating paper food. You're chewing, but there's no taste.
Does this sound familiar? Do you see yourself in this or someone you know? Remember, anhedonia is rarely just sadness. More often it manifests as indifference, as a lack of energy, and that strange, hard-to-name emptiness. To truly understand anhedonia, we must learn the mechanisms that control it. Your brain has a built-in reward system. Its heart is the dopamine pathway, a path running from the ventral tegmental area through the nucleus accumbens all the way to the prefrontal cortex. But watch out, because a mistake often appears here. Dopamine is not a happiness hormone at all. It's the hormone of anticipation. It's what tells the brain, that was good, let's do it again. It's what sparks motivation, your internal drive, or the will to act. In 2011, Treadway and Zald published a breakthrough paper in Neuroscience and Biobehavioral Reviews. They analyzed dozens of studies on brain function and reached a clear conclusion. Anhedonia isn't about pleasure simply disappearing. It's that the reward system stops sending the signal. It's worth reaching for. Imagine a car. The engine is working, the road is clear, and the navigation leads you to where you always felt best. You know where to go. You remember that you love this place. But the tank is empty. There's simply no fuel. That's what anhedonia looks like. In March 2025, another major review study was published in Translational Psychiatry, which confirmed that patients with depression and anhedonia showed deeper disturbances in the reward system, a poorer prognosis, and a higher relapse rate than patients with depression but without anhedonia. Anhedonia isn't just a symptom, it's one of the markers of the severity of depressive disorder. And here we come to an important question. Is anhedonia depression? The answer is not exactly, but the relationship is very close. According to the DSM-5 criteria, the diagnostic classification used by psychiatrists worldwide, anhedonia is one of the two main symptoms of a depressive episode. To diagnose major depression, one of two things must be present: either a low mood for most of the day or specifically anhedonia for at least 2 weeks. But here's an important note. Anhedonia can exist without full-blown depression. It often accompanies completely different conditions. In schizophrenia, it often appears as an early deficit symptom before other symptoms develop. In PTSD, emotional numbness and a lack of reactivity are part of the clinical picture. In addictions, the matter is simple. Drugs or alcohol overstimulate the reward system. Because of this, ordinary life simply becomes flat for the brain. In personality disorders, it often goes hand in hand with a sense of detachment from reality, especially in states of dissociation. And if you're thinking now, maybe it's just burnout, maybe it's because of this constant stress, you're right. Anhedonia can also strike in this case. Remember one thing: anhedonia is a symptom. It's an alarm signal that the pleasure-sensing mechanism in your brain has simply stopped working. Repairing this mechanism isn't a task for Dr. Google. I don't want to scare you, but I have to tell you something straight out. Research shows that anhedonia is one of the strongest predictors of depression severity and the risk of suicidal thoughts. In the already cited study by Wu and colleagues, it was clearly shown that patients with anhedonia respond worse to standard pharmacological treatment and experience relapses more often. Anhedonia is quiet, it doesn't scream, it doesn't signal with crying. It simply slowly sucks the colors out of everything you know. So if you notice prolonged anhedonia in yourself or a loved one, combined with isolation, self-neglect, or a sense of futility, don't just wait for it to go away on its own. It's not a matter of willpower. You can't fill an empty tank just by wanting to. Good news. Anhedonia responds to treatment, and we have hard data on that. One of the most effective tools is behavioral activation. The logic here is simple and has solid scientific backing. You don't wait until you feel like it. First, you act. Pleasure and that desired motivation, they will only appear later on. Why in that order? Because when you're stuck in anhedonia, your dopamine system won't start on its own. It simply needs an external impulse. It needs a specific movement to even kick in and send to the brain a signal, hey, this makes sense. It's a bit like jump-starting a car by pushing it. In 2024, the results of a randomized clinical trial were published, evaluating the effectiveness of behavioral activation treatment for anhedonia. A therapy designed specifically for anhedonia, not just depression. The results? Behavioral activation effectively restores sensitivity to reward center stimulation in the brain for patients where standard methods fail. How to implement this in your own life? Here are 4 steps. Step 1. A list of small activities. List 10 to 20 activities that used to bring you joy or that might bring you joy now. Not necessarily big ones. It could be a walk in the park, a favorite tea drunk slowly on the balcony, a conversation with a specific person. Don't ask if you feel like it. Just list them. Step 2. Assessment. Assign to each activity 2 ratings on a scale of 1 to 10. How difficult it seems and how important it used to be for you as a source of relaxation, connection with others, or a sense of meaning. Step 3. Plan it. Don't wait until you feel like it. Don't ask yourself in the morning if you feel like it today. Plan the activity like a meeting in your calendar, a specific time, a specific day. Step 4. Observe and record the experience. After doing the activity, even if it wasn't spectacularly pleasant, write down what happened. Anything. Did your body relax a bit? Did something click in your head? Did you stop worrying for a moment? This is very important data. The brain slowly learns again that it's worth it. And in the context of CBT, cognitive behavioral therapy also works at the level of beliefs. I won't feel anything anyway. Why even try at all? This thought is part of the vicious cycle of anhedonia. Recognizing it and working with it is one of the key elements of treatment. A study published in Psychological Medicine by Cambridge University Press in 2022 showed that after CBT therapy, patients with anhedonia showed a measurable increase in the reactivity of reward circuits in the brain. It was visible on fMRI scans. And this isn't just a subjective feeling of the patients. It can be seen on the brain activity recording. We are dealing here with a hard biological transformation. Therapy literally rebuilds the network responsible for feeling pleasure. If anhedonia lasts longer than 2 weeks and hits your daily life, work, relationships, or simple household chores, it's time for a concrete step. Don't delay visiting a specialist. A consultation with a psychiatrist or psychologist in this case is simply recommended. You don't have to know exactly what's wrong with you. You don't have to bring a ready-made diagnosis with you. You can say exactly this: nothing has made me happy for a long time and I don't know why. That's enough. This is the starting point. Anhedonia is a sneaky symptom. It doesn't scream with pain. It doesn't wake you up at night with crying. It simply slowly sucks the colors out of the world that used to be colorful for you. That's why it's so easy to downplay it, in yourself or in someone close to you. It'll pass. It's just fatigue. Others have it worse. You have the right not to understand why nothing makes you happy, and you also have the right to reach out for help. If this video was valuable to you, please leave a like, sub, or comment. Write 1 sentence about what brought you here. Or just give a sign that you're here and watching. I read every comment. Please also share this video with someone who needs to hear this. And in conclusion, as always, remember, treat yourself with the same kindness as you treat others. See you in the next episode. Bye.